Running-related injuries tend to affect bone and tendons. This is important to recognize and respect whether you are not running because of injury or training for Boston. In doing so, that can help you get over an injury quicker and overall perform better. When it comes to distance running, it's not the best stimulus for bone in isolation. Here's why. Bones are mechanosensitive. This means a greater duration of loading to a bone does not necessarily equate to greater mass and strength. This is the case of diminished returns. Bones become desensitized to prolonged mechanical stimuli. In other words, if you were to load a bone, let's say 30 or 40 times, if you were to do 30 or 40 jumps, that can produce an anabolic response to a bone that can cause it to become bigger and stronger. Having said that, if you do 100 jumps, there won't be an additive effect. Just because you did 2.5 times the jumps doesn't mean there's going to be 2.5 times the effect. Instead, bones respond better to smaller bouts of loading, but more frequent bouts of loading with large rest periods in between. This might look like 2 to 3 sets of 30 seconds of pogo jumps for those dealing with a low risk bone stress injury with large periods of rest in between, say 4 to 8 hours. The rest in between is going to allow the bone mechanosensitivity to return, and essentially the bone will then respond better with, again, those frequent bouts with large rest periods in between. This is going to help drive a positive bone response. Number 2, dynamic is better than static. In other words, dynamic loading is going to produce a more osteogenic effect, or essentially help those bones turn over and heal. This might look like high impact exercises that cause a larger deformation to that bone to, again, elicit a response for that bone to adapt. So if we look at the demands of running, it's of course a high impact sport. There's a lot of load going through those bones. If we look at a high risk site like the femoral neck, it's going to take roughly 4 to 8 times one's body weight every stride. If we look at the tibia, which is the most affected bone in terms of distance running injuries, it's going to take 6 to 14 times one's body weight. So running is a high impact sport, which is great, but here's where it goes wrong. Running is monotonous and repetitive. We live in a dynamic, unpredictable world. Bone will best respond to a variety of unpredictable inputs. This is the basics behind Wolff's Law, which essentially says bone will respond to the demands placed upon it. Bone can become thicker and stronger, or weaker and more fragile based on the stress applied to it. This principle can go either way, depending on the environment you put yourself in. In this case, abnormal strain applied to the skeletal system will drive structural change. A positive mechanical adaptation is driven by unpredictable, varied loading. The singular act of running in a straight line is not enough for bones to reach their optimal health. They need more variety. The most significant predictor of a future BSI is past bone stress injury. One measure showed females with a past injury history of a bone stress injury had a 6-fold increase for a future bone injury. If we can recognize the physiology behind bones, whether somebody is hurt or just trying to perform their best, you can essentially become a more resilient runner going forward, or help yourself get over an injury quicker and hopefully not get injured again. These 3 principles are going to be important if you're dealing with a bone injury or you're concerned with bone injury. They're going to help you manipulate the bone physiology as best you can to help you get over an injury or perhaps prevent an injury in the first place.